Assalamualaikum warahmatullahi wabarakatuh. This is our video assignment for FSG471, which is entitled Identifying Hazards of Bacterial Culture in a Laboratory.
Working with live bacterial culture poses significant biological hazards. Exposure to pathogenic bacteria can lead to infectious illnesses or even transmission of diseases. The man must ensure proper personal protective equipment (PPE), including gloves, safety goggles, and a lab coat, is worn at all times. Strict adherence to aseptic techniques, such as using a biological safety cabinet, is crucial to prevent accidental exposure. As you can see, the experimenter here is not wearing gloves, mask, and safety goggles, which pose a risk of him being in unwanted contact with the bacterial specimen. Improper packaging can lead to malfunction or damage of the autoclave, resulting in injuries or failed sterilization of materials. The technician must ensure that the packaging materials are autoclave safe, compatible with the contents, and tightly sealed to prevent any leaks. The technician must use autoclave tape or labels to indicate the items have been sterilized and are safe to use. They must also ensure that the autoclave chamber is not overloaded and there is enough space for the steam to circulate around them.
Using a Bunsen burner introduces an additional fire risk to the laboratory environment. The open flame can ignite flammable materials such as solvent, paper, or nearby combustible substances. The man must exercise caution when working near the Bunsen burner, keeping flammable materials away from the flame and maintaining a clear workspace. Direct contact with the Bunsen burner flame or heated equipment can result in burns. The flame can reach high temperatures and cause severe injuries if not handled with care. The man must use appropriate tools such as tongs, heat-resistant gloves, or other heat-resistant equipment to handle hot objects, ensuring adequate protection against burn. Next is the most highest risk in bacterial culture, which is the streaking bacteria. Working with live bacterial cultures presents a significant biological hazard. The technician must exercise caution to avoid accidental exposure to pathogenic bacteria that could cause infection or disease transmission. The technician should always wear appropriate personal protective equipment such as gloves, a lab coat, and safety goggles to minimize the risk of contact with bacterial samples. As we can see here, the technician is demonstrating the proper way of handling the streaking process, taking every safety measure, minimizing the risk of contamination and infection.